Hi, everybody. I'm Jen Johnson, and you're watching Thought by Thought Healing. I just like to get on here and talk about anything and everything having to do with chronic pain and the healing process from chronic pain that is caused by the brain and not necessarily by structural damage. And it's definitely a passion project of mine. Once you have been in chronic pain, and especially after you've recovered from it, you just want everybody to know about it because it just changes your whole world. And so I like to get on here and talk about this because I see you and I know where you are. I've been there, and pain is life consuming. And yet the process of getting out of chronic pain is life-giving. And so I'm hoping that these videos help you to kind of discover the mind-body connection and everything that's kind of entangled in the pain that our brains can cause in our bodies. And so today I just want to talk a little bit about kind of the getting stuck in the Western medicine cycle of going from doctor to therapist to labs to tests, and kind of that cycle of basically fear, and tell a little bit about my story and how hopefully it can help you to be able to avoid that pit of fear. Now, before I go any further, first I want to say that I love our medical professionals. We need them. They are important. They're our heroes. We're thankful for them. And I don't work with clients until they have done that ringer, until they have seen doctors and specialists to make sure that their pain is not caused by a structural or physical problem, because there are things that can cause pain that are structural. And so we want to make sure that we are caring for our bodies in the appropriate way. But if your pain is neuroplastic or neural circuit pain or mind-body pain, then going to the doctor can actually have the opposite effect. And so I want to talk about that a little bit. So my own story is that when I first started experiencing all this pain, I kept just going from different doctor to specialist to getting lab results and stool tests and blood tests and CT scans and MRIs and ultrasounds and all these different tests. And the problem is that I was seeking a structural answer to a brain, a part of my brain that needed love and attention. And instead, I was trying to find out what was wrong with me. And here's what I'm going to tell you. First of all, if you have neuroplastic pain, it means that there is nothing wrong with your body. And I can't emphasize that enough. There is nothing wrong with you. There is nothing wrong with me. And the brain actually needs to hear that, because right now what's happened is, well, I'll just speak for myself and probably for you, but my brain had wired in and formed, my brain had literally formed around this idea that there was something structurally wrong with me and therefore was creating pain due to places in my life that I felt in danger that was not related to structural problems. So the brain can produce pain when it recognizes that there's something structurally wrong, something that is puts you in danger, but it also produces pain when it recognizes there are emotional, mental, or spiritual places in your life that your brain detects it's not safe. But when we keep looking and continue going down this spiral of doctors and therapists and like physical therapists and specialists, we're looking for what's wrong with me. And that reinforces this fear cycle in your brain that there's something wrong with you, which then makes your body a dangerous place for you, for your brain, and it will continue to set off that pain alarm. So again, we need the doctors. We love them. I am not anti-doctor. I am not anti-medicine. We need them. And in fact, sometimes some of those specialists can help us, like if we have in neuroplastic pain avoided using certain parts of our body to avoid pain. Sometimes we need those people to kind of help us, like physical therapists, to get moving and to stop fearing our bodies and abnormalities that we may have. So some of like a part of my story is that I was stuck in this cycle, but something interesting is that I kept going to this physical therapist for a very long time. And I would notice that every time I would go to that physical therapist, that specific physical therapist, I would get there and my pain would go away. And now I know that it is because I felt safe there. My brain knew that I was seen and cared for by that physical therapist. And so my brain would turn off that pain signal and I would get there and not be able to show him where I had pain, which is kind of interesting. The same with my family doctor. I would go to see her and as soon as I would walk into that office, my pain would go away. It was crazy. And I didn't realize at the time that that was because my pain was not structural. It was mind-body pain. And yet, because I didn't realize it, I kept going from doctor to doctor and they would send me to specialists because nobody at that point in time had realized that I had mind-body pain. I do remember one time my physical therapist did become concerned that I had an aortic aneurysm. And so he told me that I needed to go and get an ultrasound. And so I called out of work sick. My pain went up. I went to the doctor who was like, I don't think there's anything wrong with you, but okay, I'll send you in for an ultrasound. And I went in and I got an ultrasound, but when I got there, he had ordered an ultrasound for my legs. Well, that's not going to detect the aortic aneurysm. And so I called my physical therapist and he said, no, you need to make sure and have this test done. And so then I went to the emergency room and got my aortic aneurysm. I had the ultrasound done to check for that. And sure enough, it came out clean. But my pain went up during that time because I was so scared and I was so determined to find the diagnoses that it set my brain into fear mode. And when that doctor did not give me an abdominal ultrasound, I actually remember I called back to the doctor and talked to his assistant who went and talked to him because I was complaining that I hadn't got the abdominal one. And he came and he told her to tell me that there was no reason for a perfectly healthy 39-year-old woman to have an ultrasound of her abdominal area. I lost it, you guys. I was so mad. I definitely used the F word, which I try not to do. And I told them off because I was in so much fear and anxiety that there was something physically and structurally wrong with me. I was looking for my answers in all the wrong places because my pain was not caused by an aortic aneurysm or anything of a structural nature. But then what was interesting is that because your doctors care about you and because they love you and they want to help you solve your pain and your symptoms, which is why they've gone into the field, they will often look for what could potentially be a structural, physical cause. And so for me, I actually got a couple diagnoses. So for those of you who haven't watched my earlier videos, I was diagnosed with fibromyalgia, central sensitization, SIBO, which is small intestines bacteria overgrowth, IBS, insomnia, carpal tunnel, and plantar fasciitis, of which those last two, actually all of them, but I'm going to talk about the last two, I didn't have. So here's how it works. When you go to the doctor, they look at your symptoms, they ask you questions about your history, things about you, they look at your medical record, and then they find a diagnosis that includes those symptoms. And they do their best to give a diagnosis. And so all of my symptoms of my pain in here match the description of what carpal tunnel was. And so when I was given that diagnosis, that sent me into fear. How am I going to provide for myself? I use my hands all day long to make my living. And that sent my pain, literally in my hands, to be worse, which is super interesting when you think about it. And so I was also diagnosed with plantar fasciitis, which I also healed from. So these diagnoses that I had sent my brain into fear and also were for me, inaccurate. I did not have a pinched nerve. I do not have, I had real symptoms. All of our pain is real, right? It is literally happening in your body. Digestion is not going well. You are not sleeping well. The pain is real. All of this is it is just as real as structural pain. But when we keep searching for the answers in the medical world, they have this biomedical approach. So they're looking for their diagnosis based on your body. In general, most medical professionals are. And that's what they're trained in. That's what they specialize in. They do not specialize in mind-body neuroplastic pain. So we can't expect them to be able to treat us when we have this pain that is caused by this other source. And so that's why for me, I feel like it is important to do your work over here in the medical world. Find out if you have structural problems. Do you have cancer? Do you have an infection? Do you have a broken bone? We do need to make sure that this is our first stop, which is not a problem. Most of us have done this. We've done the ropes. We know what's over here. We're just not getting the relief that we're looking for. So we keep looking. And this is not where you're going to find your answers. You're going to find your answers over here working with somebody who understands the mind-body connection. I'm not trying to sell myself here, but I would say that if you've discovered that you have neuroplastic, neural circuit, TMS, mind-body pain, it is best to see somebody who specializes or knows a lot about the mind-body connection and how and what types of symptoms can be caused by the brain. And that's kind of where you want to spend your time is over here. For me, I did, after I discovered the mind-body connection, I did still keep going to, I had a specific doctor that actually kind of understood that mine was due to a sympathetic nervous system dysregulation, where the sympathetic nervous system was chronically activated, fight or flight was chronically activated. She understood that to an extent. And so I actually would meet with her. She would do like a physical test on my sympathetic nervous system through my spine, and she could kind of feel the tension. It was pretty interesting. And I enjoyed that session. So I continued to work with her and teach her also. So I taught her about the mind-body syndrome / connection. And it was kind of awesome because after I completely healed, I was able to go back to her for another more traditional visit to the doctor and show her and tell her that I'd healed and share with her my website and stuff. So it was fun to be able to kind of get this news out there in the medical world. And also my counselor definitely understood the mind-body connection. I think most counselors do, but she didn't understand it to the extent that I did. And because I had no doubts once I understood this mind-body connection, I had no doubts that was me, and I didn't let any doubts in. And so because of that, I was able to kind of go in and, in a sense, teach her a little bit more. I mean, she knew most, and she was definitely the counselor in our role. But I was able to understand which of my symptoms, which was all of them, were based in mind-body syndrome. I also went back to my physical therapist after I discovered this, and I told him, I said, oh my gosh, I think I figured it out. It's fight or flight, chronically activated. And he said, and I said, that means I can heal. And he said, well, I don't know. And I said, I'm going to choose to not believe you. I know that I can heal. And I understand why he said that, because once you understand the mind-body connection, it's a system in our bodies. We have it. It's not like we heal from the way we're made. But I chose to believe hope, and I chose to believe and not doubt that my pain was caused by the brain and therefore was reversible. And so I think that we can continue going to the doctor for certain things. even if it's mind-body related, as long as we stand firmly in knowing which ones of our symptoms are caused by the mind-body connection and which of our symptoms are caused by structural. So we love our medical professionals. I won't work with clients until they have ruled out these things, because it is very important. I mean, even my sister is a nurse, and I adore her and I love what she does. And so none of this is against the medical system. It is just, it just doesn't solve our problems when we have pain that is caused by the brain. And so I love this because it gives us hope. And we don't have to be stuck in this cycle of going to the doctor and fretting and wanting a diagnosis and then going to the next doctor and doing just this cycle of anxiety and then potentially getting diagnoses that are that the symptoms match, but it's not what you have. So I hope this gives you hope and assurance that that it is worth taking this journey of looking at your symptoms from a mind-body perspective. And I hope that you can find somebody to work with, or just keep watching my videos. I'm trying to put as much content out there for free. Also, Dan Buglio with Pain For You, he puts out a lot of really amazing free content. We have slightly different approaches to the healing process. I like to look at personality traits that are ongoing and work at that level. Along with some of the ways that he approaches it too. But bottom line is, and this is really important for healing, there is nothing wrong for you. Your brain needs to hear that. Your nervous system needs to be, for at least 21 days, probably 63, it needs to know that there is nothing wrong with you. And if your pain is mind-body pain, there is nothing wrong with your body. Even now, when I say that out loud, just here in this video, I feel my nervous system kind of go, that's nice. There's nothing wrong with my body. So I would encourage you on a daily basis to tell yourself and remind yourself, there's nothing wrong with my body. I am okay. And that can send a sense of safety. When we're looking at chronic pain, we're looking at mind-body pain, we are looking at safety. And physical pain is just one part of the safety cycle, I guess, the peeling back the layers of the onion of ways that your brain is perceiving that you're not safe. So thanks for being here with me today, and have a great week, and I'll see you guys next time. Bye.